Join me as I put the claims to the test and find out if taking aspirin during a heart attack really can save lives. When it comes to heart attacks, every second counts, and quick action is crucial in saving a life. Aspirin is often recommended as a first response because it can help prevent further damage to the heart by reducing blood clotting. Aspirin's role in heart attack treatment is often shrouded in misconceptions, with some people believing it's a magic pill that can instantly save lives. However, the reality is more complex and there are potential risks involved in its use during emergencies. Aspirin can interact with other medications, and its effectiveness depends on various factors, such as the severity of the heart attack and the individual's medical history. The idea that aspirin is a foolproof solution has been debunked by many medical professionals who argue that it's just one part of a comprehensive treatment plan. In fact, aspirin may not be suitable for everyone, particularly those with certain medical conditions or taking specific medications. This highlights the importance of consulting a doctor before taking aspirin or any other medication during a heart attack. While some people swear by aspirin's effectiveness in saving lives, others claim it's overhyped and can even do more harm than good. The debate surrounding aspirin's role in heart attack treatment is ongoing, with some arguing that its benefits are overstated and that other factors, such as prompt medical attention and lifestyle changes, are more critical in preventing heart attacks. The scientific research surrounding aspirin's role in heart attack treatment is fascinating, with studies showing that it can help reduce the risk of death and disability by preventing blood clots from forming. Aspirin works by inhibiting the production of chemicals that contribute to blood clotting, which can help prevent further damage to the heart. Many experts agree that aspirin can be a valuable tool in heart attack treatment, but it should be used judiciously and under medical supervision. Experts also emphasize the importance of prompt medical attention, as aspirin is not a substitute for proper medical care. In fact, delaying medical attention to take aspirin can actually do more harm than good, as it can lead to a delay in receiving more effective treatments, such as clot-busting medications or angioplasty. Aspirin should be used in conjunction with other treatments, not as a replacement for them. The mechanism by which aspirin works is complex, involving the inhibition of enzymes that contribute to blood clotting. This can help prevent the formation of new clots and reduce the risk of further heart damage. However, aspirin's effectiveness depends on various factors, including the dose and timing of administration, as well as the individual's medical history and other health conditions. One of the most compelling pieces of evidence supporting aspirin's role in heart attack treatment is the ISIS-2 trial, which found that aspirin reduced the risk of death by 23% in patients who had suffered a heart attack. This study, along with others, has helped establish aspirin as a valuable tool in heart attack treatment, particularly when used in conjunction with other therapies. Another study published in the New England Journal of Medicine found that aspirin can reduce the risk of recurrent heart attacks and strokes in patients with a history of cardiovascular disease. This study provides further evidence of aspirin's effectiveness in preventing cardiovascular events and highlights its potential as a long-term treatment option. The evidence from these studies is backed up by expert opinions, with many cardiologists and medical professionals agreeing that aspirin can be a lifesaver in heart attack emergencies. However, they also emphasize the importance of proper medical supervision and the need for individualized treatment plans that take into account a patient's unique medical history and needs. In addition to these studies, there are many anecdotal reports of aspirin saving lives in heart attack situations, with some people crediting it with preventing further damage and reducing the risk of complications. While these reports are not scientifically proven, they do highlight the potential benefits of aspirin in heart attack treatment and the importance of having it on hand in emergency situations. In summary, the evidence suggests that aspirin can play a valuable role in heart attack treatment, particularly when used in conjunction with other therapies and under medical supervision. However, it's essential to be aware of the potential risks and limitations of aspirin and to consult a doctor before taking it or any other medication during a heart attack. If you've had any experience with aspirin during a heart attack, or if you have any thoughts on its effectiveness, please share them in the comments below. And if you're interested in learning more about heart health and medical emergencies, be sure to check out our other video on the top 5 things to do in a medical emergency.